Good day everyone. Today I want us to talk about catheter. What is catheter and who uses a catheter? Catheter is a tube which aids people that are not able to urinate on their own. This is a catheter. I'll show you how it's being. This is a catheter. You can see it. So, and catheter is what aids people to urinate who are not able to urinate. For instance, somebody has a spinal cord injury like me, or any other form of disability, or any other form of illness. So, but our concentration is people who use catheter for temporary or for a long term. Those people that use catheter in the hospital, after their discharge, are no longer using catheter. So this catheter, both male and female uses for catheter, but our focus is on people of spinal cord injury. Most people with different level of spinal cord injury uses catheter. Most people, though few percentage, are not using what? Catheter, but are still richer users like me. So in using the catheter for female, you use ureteric catheter. For male is condom catheter and other similar ones. But as time goes on, due to infection and due to prolonged of unable to have sensation to urinate, it's advisable that they proceed to what they call a suprapubic cystomy, that's SPU. So in this particular SPU is a procedure, both for men and women. It is done by cutting a small part of your under belly button, and this catheter you see, but this catheter you see is not silicone catheter. In suprapubic you use a silicone catheter. So they use this catheter and insert directly to the bladder and attach it to the urine bag, both for male and for women. How do you care for this? Because this is going to be for a long term or short term, 2 years, 5 years, thereabouts, or a lifetime. How do you care for this particular catheter and urine bag to avoid smelling, to avoid many infection? And yes, you know that this catheter is a foreign body. No matter how, there will be what? Infection. But it will be what? Little amount of infection when you're using SPC. But even if you're really using urethra and you're able to take care of yourself, you might not be having much what? Infection. So how do you care for this what? Catheter. Every day, this is catheter. Let me remove this one to show you for an example what the catheter looks like. Okay, so this is a catheter. You can see this is a catheter. So you can see the mouth. This one is what is being inserted to the vagina, to the underbelly button if it's suprapubic, so that urine will pass. So you see this tube now, it has two mouths. So let me open this tube for you to see. And also, this is the urine bag. This urine bag is 2000. Okay. This is the urine bag. You can see. Okay, I can drop this on the ground. So this is the urine bag. You can see this urine bag is 2000 ml. So this urine bag is being inserted to this catheter. So remember that this one goes inside. If it's suprapubic, this one goes inside, way inside, but it will be what? Fleeted with injection water to avoid what? Pulling out. But that's not what we are talking about today. If it's also urethra, it's the same thing. So now this one pulls out. You see it. You go to hospital, you can see it hang and all that. But now you are in the house. How do you care for this your catheter? So every day you clean this one that comes out from the body with what? Sterilized cotton wool and ventilated spirit. Clean it. This is the urine tube. You clean this one, you stop. And it's advisable that you also wash this one daily. And this is where you empty the urine. So in this, to avoid having infection, to avoid falling sick, and also for people seeing it around, you can also have it tied around your leg, or customize your clothes that it has a bag in front. So you clean it every day. You wash it when you're bathing. If you do bed bathing or shower bath, anyone, you wash it. And this urine, but make sure you take enough water. I mean, it's very, very important that if you are using a catheter, that you drink enough water. So you drink enough water that the urine can flow out very well. And you can also pour water here inside. And bend this tube that the urine, you bend, this is the catheter now. You pour water from here after emptying. You bend the tube like this that the water do not flow inside. Then you rinse it if this is on when you want to rinse it. But it's always advisable if you want to wash your urine bag, you disconnect it from here. But too much disconnecting can cause what? Infection. So every day you clean your ventilated spirit, drink enough water, rinse the urine bag to avoid it smelling. This urine bag can last for 1 week, for 2 weeks, even for a month. But it's advisable after 2 weeks you can change it. Or if you get a reusable one, you can actually rinse it, wash it. You do it yourself, don't send your carer. Put a little omo and mild water, let it go inside, you rinse it, and you see, nobody will know that you're having a urine bag. The house will not be smelling. You will not even be smelling by yourself, and life goes on. Then, for somebody that have a suprapubic cystectomy, this one is inserted directly under your belly to your bladder. There is an opening 247 there, but it's not going to be pulled out. So every day you clean it. If when you are being discharged from the hospital, you clean it with what? Sterilized gauze and sterilized cotton wool or sterilized gauze, and then you dress it with a gauze and plaster it lightly. Use a plaster that will not injure your skin. Many people have fallen a victim of using plaster that is not good to the skin, actually cause burns or peel the skin off. So you do that cleaning till that surface heals. And for suprapubic, in my own case, I change every 8 weeks based on doctor's instruction, and some is 6 weeks, some more, just depending. And this is something that, yes, if we are well directed, you can actually do this changing of catheter by yourself in the house, but we're not going to talk about it. So it's about making staying cleaning, staying hygiene, staying very, very healthy by taking good care of your catheter. The infection that comes from catheter will make you so sick, so weak. It's something you don't want to experience. But taking very good care of it, cleaning it, washing it, will make you stay healthy. So this is catheter connecting with the urine bag. So clean it every day, stay healthy, and stay well. So it's Monica Arinze. Like my channel, comment. If there is any other thing you want us to talk about, you can just drop it on the comments. But as time goes on, I'll be discussing 1 or 2 things that has to relate with surviving with spinal cord injury. Thank you and have a lovely day. This is Catheter and this is urine bag.